Now, the issue of bogus doctors has increasingly become a concern in light of the rise in the number of unqualified and unregistered medical practitioners putting lives in danger. This is particularly alarming in instances where these doctors are not known to be fake. But now, a new online directory will be able to verify healthcare practitioners and facilities. I'm joined now by Dr. Ntuthuko Bhengu, who's the founder and CEO of Alchemy Health Technologies, to weigh in on this matter. Very good afternoon to you. Thank you so much for your time. Reports from the Health Professionals Council of South Africa reveal that a staggering increase in complaints about alleged bogus doctors. I mean, they're looking at numbers of over 300 cases being flagged just this year alone. How crucial is it to know whether or not the doctor you're going to is fake or not?
Good afternoon, Paul. Good afternoon to Newzroom Afrika viewers. Thanks for having me. As you can imagine, we are talking health, so it is very crucial that patients know that they are consulting practitioners who are qualified indeed. It's a matter of short and long-term health, and of course the risk of consulting and not getting the help that's required will have economic implications as well, because you most likely have to go and consult again.
So the Health Site Doino online directory, how useful will that be in curbing the number of bogus and fake doctors?
Yes, it will be useful because it's obviously growing as we go about encouraging practitioners to onboard themselves, but also members of the public to recommend practitioners that they have faith in. We will do the follow-up. What matters is that those that are listed have been verified, and we use the statutory body, which is the Health Professions Council, for medical practitioners. But let's remember that you have you've got 12 boards of the Health Professions Council. So it's not just doctors, but I do understand that for the purposes of today, we're talking specifically about doctors.
Yeah, absolutely. Easy telltale signs of unqualified healthcare providers. How does one see that perhaps the consultation is with a bogus doctor?
Yeah, I think it starts with the media, social media that's obviously been topical. You are unlikely to have a qualified practitioner giving advice broadly on social media simply because it's not advisable. The Health Professions Council does not recommend that healthcare advice be given through this medium. And the only exception really is if the patient is the one that consults the practitioner. And in that case, this is now in an emergency, let me be clear. And in that case, the practitioner is encouraged to quickly move the consultation into a healthcare setting as it's described. So that is one way, but obviously do you have means of identifying through the Health Professions Council registration number? That's always going to be critical. But even the information that you are given, it is very clear that you need to have a name, surname, and the discipline must be written out either in the practice or in stationery. Discipline here, I'm referring, it must state clearly that are you a general practitioner, are you a pediatrician, are you a general surgeon? It must be clear and then supported by actual qualifications with the institution that awarded that qualification. Here, obviously, we're talking about MBCHB, MBBCH, and one of the 9 South African universities, it's a practitioner that's qualified here in South Africa. And then the critical one is, of course, that the name matches the council registration number, which can be checked online through the HPCSA register, or of course the practitioner can also, which we encourage people to do, request a certificate which will also reflect the name and all of these important details, but also the council registration number. And if a practitioner is in private sector, there is an additional number which we call the practice number. This is issued by the Board of Health Funders, which is an industry association for medical schemes. The practice number is intended to facilitate payment for services that have been provided in the private sector and are to be paid for by medical schemes. So that is also an important second number that we obviously encourage that people be familiar with. The main thing is that's only for those in private sector. Those who practice in public sector are unlikely to need the practice number unless they work both in public and private sector. The other 2 points are not really specific for healthcare, but it's just what we know could potentially be red flags for businesses that are intended to be here today and gone tomorrow. Is there a physical address that indicates where the practitioner practices from, or is it just an email address? Is there a landline, or is it only a cell phone that's written in there? So you obviously look at this in totality, but it comes down to the Health Professions Council registration number.
Why would you say we're seeing such a dramatic increase of bogus doctors? Is it because it's easy to just set up and put a sign and operate and, you know, appear as though you know what you're doing when you consult people?
Yeah, I think the other point to make is that when we call bogus doctors and we look at how the Health Professions Council's views these, there are essentially two types. One is someone who originally qualified as a medical practitioner, but for some reason was deregistered or suspended. And the other, which obviously is the one of even more dangerous, but also of interest, is one who never qualified as a practitioner in the first place. Now, Health News cites that the economic situation makes people very much exposed to the doctors who are supposedly cheap if they are going to either they are out there in practice, they tend to be, obviously one sees why, they tend to specialize in sick notes. And then, of course, if it's through social media, you know what, it's free advice, I'm sitting at home. But then when they start selling product or engage in what we call touting or canvassing, that is clearly frowned upon by the medical sort of profession. So that those are also very big red flags that one should be mindful of.
Very well. Thank you so much for that very sound advice, Dr. Ntuthuko Bhengu, who is the founder, CEO of Alchemy Health Technologies, just issuing a warning, the issue of bogus doctors, which has become a concern recently, given